Babies born to gestational diabetic women are mostly very big. Large babies weighing 9 pounds or more are more likely to get stuck in the birth canal and become injured. Scary, right? The topics being tabled in this video is what gestational diabetes can do to your baby. Gestational Diabetes Diet Plan. Gestational diabetes. Gestational diabetes is when diabetes is deciphered for the first time while pregnant. Gestational diabetes affects how the cells in our body use sugar, much like other types of diabetes. Increased blood sugar levels by gestational diabetes can harm you and your unborn child. Blood sugar management can ensure the health of both you and your unborn child and avoid a challenging birth. If you had pregnancy-induced diabetes, your blood sugar often returns to normal shortly after delivery. Causes. The cause of pregnancy-induced diabetes is still not known. Some women develop it while others do not. Pregnancy weight gain is frequently a factor. Typically, several hormones control blood sugar levels. However, due to altered hormone levels during pregnancy, the body has a tougher time effectively processing blood glucose, and this causes a spike in blood sugar levels. Although the exact causes of gestational diabetes is unknown, there are some precise effects on the baby, such as hypoglycemia and others, that we will address shortly. Risk factors. Here are some risk factors. Having an excessive weight, not exercising enough, a pre-diabetic condition, having gestational diabetes from an earlier pregnancy, being a polycystic ovary syndrome patient, diabetes running in one's direct family, having just had a baby that weighed more than 9 pounds, 4.1 kilograms, being a member of a certain racial or ethnic group such as Black, Hispanic, American Indian, or Asian American. Signs and symptoms. Gestational diabetes affects many pregnant women without any obvious symptoms. Pregnant women are encouraged to get screened for the disorder because of this. Here are a few signs, though. Regular and more frequent urinating, more thirst, fatigue, vomiting and nausea. Even with increased appetite, one loses weight. Blurry vision, infected yeast. Complications. Uncontrolled gestational diabetes can cause high blood sugar levels. You and your unborn child may experience issues due to high blood sugar, such as an elevated chance that you will require surgery to deliver C-section. Some ways gestational diabetes affects your baby are overweight at birth. Your baby may become too big if your blood sugar level exceeds the recommended range. Babies of 9 pounds or more are more likely to experience birth injuries, get trapped in the delivery canal, or require a cesarean section. Imagine having to dread carrying your own baby because he or she is too heavy. Preterm labor. Early labor and childbirth before the due date may be more likely in people with high blood sugar levels, or the baby might be so big that an early birth is advised. Breathing difficulties. Mothers with gestational diabetes may give birth to babies who have respiratory distress syndrome, a condition that makes breathing difficult and can occasionally result in the infant's death. Low blood sugar. Shortly after birth, newborns can experience hypoglycemia or low blood sugar. Babies that experience severe hypoglycemia may experience seizures. The baby's blood sugar level can be returned to normal with prompt feedings and an intravenous glucose solution. Aside prompt feeding, other ways to prevent gestational diabetes will be discussed later. Type 2 diabetes in later life. Immaturity, the chance of developing obesity and type 2 diabetes increases among children born to mothers with gestational diabetes. This is part of the reason Bryan Adams said, "Managing diabetes is hard because if you don't, there are consequences you'll have to deal with later in life." Stillbirth. Uncontrolled gestational diabetes increases the risk of a baby dying either before or soon after birth. You certainly do not want to experience this, do you? Subscribe to this channel to get similar health-related videos. Prevention. You may take a few steps to help lower your risk of getting gestational diabetes. But it's crucial to know that if you get the condition, it's not your fault. By adopting dietary changes that keep your blood sugar levels normal and help you gain less weight throughout pregnancy, if you are overweight or obese, you can reduce your risk of developing gestational diabetes. However, dietary adjustments haven't been demonstrated to stop gestational diabetes in women who were at a healthy weight before becoming pregnant, BMI 18.5 to 24.9. You may reduce your risk of gestational diabetes by exercising early in pregnancy. Gestational Diabetes Meal Plan. The optimal diet for gestational diabetes varies depending on the individual, if that's what you're wondering. The ultimate goal is to include items that promote healthy blood sugar levels, but how you go about it depends on your particular diet. Complex carbohydrates. Given that carbohydrates raise blood sugar levels more than fat or protein, it's critical to be mindful of the kind and quantity of carbohydrates you consume. Aim for 15 to 30 grams of carbohydrates for every snack and 30 to 45 grams per meal. But see your dietitian about your requirements. They'd often opt for complex carbohydrates because they have more fiber, which slows digestion and prevents blood sugar spikes. Complex carbohydrates include beans, healthy grains, and veggies. Pair carbohydrates with protein. To avoid blood sugar spikes, combine carbohydrates with protein and good fats. Additionally, because protein and fat break down more slowly than carbohydrates, it helps to keep you full. Consider eating an apple with peanut butter as a snack instead of just an apple because it has protein and healthful fat. Eat at regular intervals. Daily meals should include 3 meals and 2 to 3 snacks. Eat all of your meals. It may cause your blood sugar to fall too low and deprive you and your baby of nutrition. Plate method. The plate method makes eating a balanced, healthy dinner straightforward because it allows you to eyeball suitable servings without having to get out a measuring cup or count calories. At each dining, try to fill half of your plate with non-starchy veggies, 1/4 of your meal with lean protein, and 1/4 with whole grains. Every meal should have an equal amount of carbohydrates. Obesity is one of the many causes and effects of gestational diabetes. We recommend our video on obesity prevalence fact statistics, the main causes of obesity, for you to learn some causes of obesity. Thanks for your time.